There's been a big change in women's health, and it is all about how the medical community has incorrectly been labeling a disease for years. PCOS, or polycystic ovary syndrome, has been changed to PMOS, and this is a good thing. Hi, my name is Dr. Basma Faris. I'm a board-certified OBGYN with an expertise in PCOS, which is now PMOS. So what is the actual reasoning for changing the name PCOS, and why does it make sense? Calling PCOS polycystic ovary syndrome is like calling diabetes a pancreas problem. Technically, the pancreas is involved, but that barely scratches the surface of this chronic problem. PMOS, or Polyendocrine Metabolic Ovarian Syndrome, makes a lot more sense in terms of what is actually happening to women in this condition. This isn't just doctors shuffling letters around. This is the single biggest name change in women's health in decades. And it could change how you get diagnosed, how you get treated, and how seriously this condition is taken. There are a few reasons why this is so important for women's health. First, let's talk about what was wrong with the old name. Polycystic ovary syndrome literally means a syndrome of many cysts on the ovaries. Here's the problem. Those aren't actually cysts. They're small, immature follicles. Every woman has follicles on her ovaries. In this condition, they just don't mature and release an egg the way they should. So the word cyst in the name has been misleading patients and even some doctors for decades. And there are more problems with the terminology PCOS. The old name made it sound like this was just an ovary problem, something only a gynecologist handles. But in my practice, I see the reality every day. This condition affects so much more than just the ovaries. It involves hormones, metabolism, mental health, skin, weight, cardiovascular disease risk, and even sleep. I'm both a trained nutritionist as well as a gynecologist, and many days I'm using more of my nutrition background than my OBGYN training to help my patients. So what does the new name for PCOS actually mean? Let's break down the new name. Polyendocrine means multiple hormone systems are involved. This condition doesn't just affect one hormone. It involves insulin, androgens like testosterone, and the hormones that regulate your menstrual cycle. That's why symptoms range from irregular periods to acne to hair growth in unwanted places. Metabolic captures what research has been showing for years. This is a metabolic condition at its core. Up to 80% of women with this condition have insulin resistance. They're at higher risk for type 2 diabetes, high cholesterol, high blood pressure, and cardiovascular disease. These aren't side effects. They're central features of the condition. Ovarian keeps the ovary in the name because ovarian dysfunction is still part of the picture. But now it's in its proper place as one piece of a much larger puzzle, not the whole story. And syndrome stays because this is a collection of related features, not a single disease with a single cause. Now here's why this name change matters so much for patients. Under the old name, up to 70% of people with this condition were going undiagnosed. Studies show that a third of women waited more than 2 years to get a diagnosis, and nearly half saw 3 or more doctors before anyone figured it out. That's not acceptable for a condition that affects roughly 1 in 8 women worldwide. Part of the reason for those delays is the name itself. When doctors hear polycystic ovary syndrome, many think of it as a fertility issue. So if a young woman comes in with weight gain, fatigue, acne, and anxiety, but she's not trying to get pregnant, the connection often gets missed. The old name kept this condition trapped in a reproductive health box when it needed to be recognized as a whole body condition. There's also the stigma factor. Many women have told researchers that the word cyst made them feel like something was wrong with them, like they had a disease of the ovaries. The new name removes that unnecessary stigma and replaces it with language that actually reflects the science. This name change didn't happen overnight. It came from a massive global effort involving 56 leading medical and patient organizations. Over 14,000 patients, healthcare professionals from every region of the world participated in surveys, workshops, and consensus rounds. The process was published in The Lancet, one of the most respected medical journals in the world. This is as rigorous and democratic as a name change gets in medicine. So what does this mean for you right now? If you've already been diagnosed with PCOS, your diagnosis hasn't changed. The condition is the same. The criteria for diagnosis is the same. What's changing is how the medical world talks about it, researches it, and ultimately how seriously it's taken across every specialty, not just gynecology, but endocrinology, cardiology, psychiatry, and primary care. There will be a transition period where you'll see both names used. Think of it as PMOS, formerly known as PCOS. Over time, the new name will become the standard in medical records, guidelines, and research. If you haven't been diagnosed, but you're dealing with irregular periods, unexplained weight gain, stubborn acne, excess facial or body hair growth, thinning hair on your head, or mood changes like anxiety and depression, please bring these up with your doctor. These symptoms deserve a proper evaluation, not dismissal. And if you're in New York or any of the other states I'm licensed in, I can offer you a visit through telehealth. Remember, every person's situation is different. Your test results, your symptoms, and your next steps all depend on your individual medical history. This video here is to educate and empower you, not to replace a conversation with your own healthcare team. Here's the bottom line. This name change is a win. It's more accurate, it reduces stigma, and most importantly, it has the potential to get more women diagnosed earlier, treated better. That's what good medicine looks like. If this helped you understand what's happening, share it with someone who needs to hear. And if you have questions about PMOS or your own health, drop them in the comments. I read every single one.